bring in Dr. Jesanna Cooper, an OBGYN and the former chair of the Women and Infants Division at Princeton Baptist Medical Center, one of those very hospitals closing its maternity unit. Dr. Cooper, a pleasure to have you on, although I wish it were under different circumstances because this is terribly anxiety-inducing for expecting parents. It's honestly surreal that facilities can call themselves hospitals and not deliver babies in the year 2023. What's been your reaction and response to the news?
I think similar, where I've been shocked and disappointed, sometimes not surprised, but still disappointed. The rural closures, hospital closures, is something that we've been watching happen in real time here in Alabama, really for the last 20 to 30 years. And I do think we're reaching a tipping point where we're also now seeing bumps in our rates of maternal mortality and infant mortality. And hopefully this will start driving real change because it's been so concerning. And to see it then creep into the Birmingham market, where you thought this was a rural problem, where cost and staffing is the driving factor, but it's different factors once you get into the city, more so of an issue of hospital groups consolidating service lines and looking to put all their services under one roof rather than serving the communities where these women are living.
I know several different areas of Alabama have been considered maternal care deserts for quite some time. This just makes the problem that much worse. The state of Alabama has been losing, to your point, delivery units for decades. And I want to pull up a graphic here, if I could, from the Alabama Department of Public Health. And it's comparing the amount of obstetric units in 1980 to 2019. Alabama has 54 counties. 45 counties offered OBGYN services back in 1980 compared to only 16 counties with services in 2019. The state is about to lose 3 more. Where does this leave pregnant women with care? I mean, Dr. Cooper, what does their new reality truly look like?
So, I think you showed it earlier on your segment. It's really becoming the norm to drive at least 30 to 45 minutes to get your labor and delivery care. And for a lot of these women, we're looking at, 60 minutes, 90 minutes, 2 hours. And, I think the dramatic part of that is the emergencies that are going to occur on the road, or if you show up in a more local hospital that does not have maternity services, does not have a team that is specialized in delivery, the ability to do a C-section, a team that specializes in neonatal resuscitation, we're going to see more and more bad outcomes because of this. And unfortunately, it really is becoming the norm. I think the other side of the coin is when you lose these services, you lose the physicians who are working in the communities. So I know in rural areas, it's hard because we have physician shortages, and it is hard to recruit physicians and maternity care providers to those areas. But within Birmingham, what you have is you have 2 hospitals where you had providers working and happy with their practices there, who are now going to have to find other places to deliver because that hospital is gone. And when you lose those providers, you're going to lose prenatal care, access to things that can prevent the serious outcomes in the emergencies. You're going to lose postpartum care, where you see a rising, that's the period where we see a rising number of maternal deaths.
Right.
And you're going to lose GYN services, so early cancer detection for GYN cancers. You're not going to have access to those kinds of interventions and early detection services in these communities.
And Dr. Cooper, when you're talking about, these emergency situations, those will still happen, whether or not you're 90 minutes away and, you can't make it 3 counties over. So if a woman shows up at the hospital and it's go time for her, she can't drive 3 counties over, do they get turned away? Do current doctors and nurses get basic training when it comes to childbirth for just emergency situations? I mean, how does that play out?
So there are laws that say you cannot turn a person away in that kind of an emergency situation. And so you will see more women delivering in an emergency room setting. Emergency room doctors do receive some basic care in obstetric emergency and in delivering babies. I would imagine that with these changes coming, they might up some of that training as far as neonatal resuscitation, but it's not going to be a replacement for true maternity care providers who have specialized this throughout all of their training and career. And you still will not have the surgical services. So cesarean section is not something that emergency room physicians are trained to provide. And that's a pretty major intervention in a lot of obstetric emergencies.
And thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.